Good morning, good afternoon, or good evening, depending on which part of the world you are connected. Welcome to another webinar of the Community of Practice on Terrestrial Animal Biosecurity. My name is Damian Tago. I'm Biosecurity Coordinator here in FAO headquarters, and I will be animating the webinar today. This webinar is the first webinar, not just the first webinar of the year, but also the first webinar of a webinar series that we are organizing in collaboration with the World Animal Biosecurity Association. And today we will be talking about implementing biosecurity through a holistic approach through the World Animal Biosecurity Association, standard operating procedures and information. We were supposed to have two speakers today. The first one was Professor Mo Salman, but unfortunately he had some last minute challenges to connect. But we have Professor Claude Segerman. He's professor in epidemiology and risk analysis applied to veterinary sciences at the Faculty of Veterinary Medicine of the University of Liège in Belgium. Before passing the microphone to Professor Sagerman, just want to remind you the format of the webinar. We'll have the speaker and then we will dedicate some time to Q&A. So please write down your questions in the Q&A section in the Zoom. Feel free to introduce yourself in the chat, but it's important to use the Q&A functionality for the questions because otherwise your question might get lost, okay? And remember, the webinar is recorded and we will upload the webinar recording for those of you that are not able to stay for the whole session. I will stop here and I will pass it to Professor Sagerman. The floor is yours.
Thank you very much. Thank you also to the FAO to offer the platform for this serial of webinar. And hello to you, to all of you, and also Happy New Year for all of you. I share my screen for my presentation. You find the presentation, please inform me.
Not yet, Claude.
Okay, I rebel. Wait a moment. Yeah, this one. Normally it's okay?
Now it is okay.
Yes, perfect. My presentation is the development and implementation and evaluation of biosecurity standard operating procedure that was concatenated in a manual in a veterinary education establishment. I divide my presentation in three parts. First, a small part about the standard and critical point to consider. The second part is the development of biosecurity SOP. And the third part is how to evaluate this. For the first part, first of all is the definition of biosecurity. We have a lot of definition of the biosecurity, but inside a SOP of VE, donc Veterinary Education Establishment, we use the definition of the AAVE that was the process employed to ensure that biological, biochemical, and biophysical agents are managed safely such that people, animal, and environment are protected from the contamination by this agent. Biosecurity include all of the concepts like different things, but also behavior and also biohazard and biosafety. Some standards should be to consider, and related to the Europe is an example, of course, of this presentation. three standards are very important. The first one is dedicated to the livestock facilities, animal housing, core clinical teaching facilities, and equipment used by this establishment for teaching purpose. The second one is the isolation and containment of animals with communicable disease, because if you have a zoonotic disease, it's important to make the good decision. The third standard is the biosecurity soap manual that was very dedicated to all of the people that inside the facilities, and you need also to have a dedicated committee and a system of quality insurance. The critical point considered by experts during a visit of an establishment is frequently the fact that you have relevant biosecurity soap easily accessible, for example, on a website, amended regularly, taught the staff and student, posted on relevant place, and fully and correctly implemented. We need also to consider environment, and especially for the veterinary education and practice, and by the implementation of the 3R approach, reducing waste, reusing tools, and recycling resources and products. But not forget that very important, with the same evidence-based level of protection. If you have not the same level of protection, you need to be conservative and to use, for example, alone equipment. Now we pass to the second part that was more important, the development, implementation, and evaluation of the biosecurity soap, but especially the development of the biosecurity. And for this, we recommend first to have a dedicated team that was related to the biosecurity of your veterinary education establishment. And by the way, it's very important to have one contact person by entity, for example, clinics, necropsy room, farms, etc. It's very important also to include very early student in the process, for example, preclinical and clinical level of education. To define the member of the executive committee, because we have a daily activity on biosecurity, thus we need an executive committee with few people. And also it's very important to have this recognition of this entity by the veterinary education establishment. Very important also, you need to consider all the SOPs and labs for education that was concerned by your veterinary education establishment. And you need to define the task of the biosecurity teams and to organize regular meeting, for example, 3 by year or more if needed, and to give feedback. And the feedback should be made by the meeting report and also an annual report of the activity of the teams. The main mission of this team is the update of the biosecurity SOAP and also the biosecurity education program for all of the actors that was involved in the establishment. And also, very important, to assess a human and logistical means that was required to reach the objective that was mentioned above. And also, of course, you need to elaborate some scenario, crisis scenario, like, for example, African swine fever or lumpy skin disease, etc. For this one, we organize this by 4 key instruments. The first one is the SOAP. The second one is a dedicated website that was related to the SOAP, but more practical. The third one was the Faculty Biosecurity Day. It's important to give emphasis about the biosecurity in the veterinary education establishment. and also to perform education and training for all of the members of the staff and student. The first one is the biosecurity. You show this biosecurity soap, and you find by the different logo of the species that was very a broad range of the species that was involved in the veterinary education establishment. And in the right, you have the dedicated website that was related to this soap, but more practical, more concise, of course, and illustrate. The type of contents of this soap, you show this, you find that you have 18 different chapters, and some chapters are novel because it's frequently updated every 5 years, but we have 3 different chapters that was added considering the previous version of the soap. And you find you have a general chapter, and after that, the different chapter in function of the species, also food science, biosecurity, experimental farm, veterinary management of animal resource, animal anatomy, wildlife, because it's important, teaching laboratory and diagnostic biosecurity, pest control soap, laundry, antimicrobial resistance, quality assurance, crisis scenario, and some tasks for the future. We translate the biosecurity soap into a website, a dedicated website, concise, operational, educational, and you find this website was very visited around the world, and it's important because it's a sort of guidelines that should be applied directly in the clinics, for example, and all of the things I presented, that what is the main task before to entrance in the clinic, during the clinic activity, and after. And we explain just one example for the general biosecurity. You found that you have, this one is better, general biosecurity, and we explain what is in this chapter. You find that you have some information about zoonosis, emerging disease, triple brood, antimicrobial resistance is the topic that was very important for clinics. You have some definition and the general principle of the biosecurity, but we show this after. And you have also implementation, floor marking, marche en avant, class of risk, equipment, behavior, in the event of an accident, what is the good behavior and what to deal with this, the waste management, cleanliness of the premise, etc. And you have also continuing education, basic biosecurity, and also the different report about the biosecurity day. And for example, this year, we organize in some day after how to communicate effectively about biosecurity. And you have also the activity report. The rule that was used in the VE is the rule of the 5 BIOS. It's currently the most important definition that was plebiscited according a World Survey. It's defined by 5 BIOS. The first BIOS is for the bio exclusion. The second one is bio-containment, bio-compartimentation, bio-prevention, and bio-preservation. Bio-exclusion is the biosecurity measure preventing the introduction of the pathogen in the farm, the clinics, of the labs. The bio-compartimentation is the biosecurity measure that preventing the spread of the pathogen within the farm, clinics, and the labs. The bio-containment is the biosecurity measure that preventing the spread of the pathogen to other farms, clinic, and labs. The bioprevention, if you have a zoonotic disease, for example, is the biosecurity measure preventing the spread of the zoonotic pathogen to human. And the biopreservation, depending of the life cycle of the pathogen inside the environment, is the biosecurity measure preventing environmental contamination. And we use this in all of the clinics with the same principle. Just some example, floor line of the ground, you are green, yellow, and red. Green line, no restriction. Yellow line, you have some restriction, but a student should be pass. But red line, the passage is only allowed unless clinical science authorization. For example, operating theater, cadaver, storage place of isolation facility, for example. And we use only the floor marking for all of the VE. You have also a code of color, for example, for the boots. You have here yellow boots is only dedicated to necropsy room. It's more easy to verify, of course. And here you have, for example, boots that was only used for big clinics. You have also a categorization of patient in function of the risk, normal housing. You have two different things. Infectious disease caused by pathogen that have no likelihood of transmission to other animal and no potential of human infection. The second one is infectious disease caused by pathogen with low level of transmission of no resistance bacteria infection. And the third one is more important, is barrier nursing precaution, for example, subclass 1, multi-drug resistant bacteria, and subclass 2, infectious disease caused by pathogen with moderate level of transmission and or zoonotic pathogen, for example. And the isolation class 4, is infectious disease caused by pathogen with high level of transmission and or causing severe disease in human. And reportable disease is an example. And you find that depending on the class of risk, you have not the same equipment. For example, this one is classic equipment for farms, for example, of a clinic. This one is the same, but we have an apron, an unique apron that was covered over your equipment. And here is for class 4 with glove, for example, it's important. And also in each of the clinics of each of the area and area with animals, you need to use a sort of define together the highlight by clinical sector and show this in the front of the building. It's a poster of pictogram. Here is a very robust pictogram. And it's very important to target at least, and but not more, because it's the most important 10 important fact that should be followed. The next instrument is the third, is the introduce of the faculty biosecurity day per year. And each year you have a biosecurity day that was very important because it's aggregate around 100% by day, by edition. And you find that you have a 13 different edition now. It's organized by the team of biosecurity unit, including student. It's for staff, student, vet, authority, other stakeholder that was interested. The program was based on the needs from the participant because we investigate the expectation by the participant before. It's free with some moment of interaction and discussion. The participation require for staff because at least one followed by 3 years or 5 years, depending of the VE. It's important to have a sort of continued education program for all of the staff. The morning is selected keynotes, and the afternoon is directly practical exercise in the field of work, cafe, case studies, etc., depending of the subject. We have a certification by the authority, and all of the presentation are directly available in the website. Here is some example, cleaning and disinfection. For example, one topic of some the previous year. And now for this year, we have a talk and subject that how to communicate effectively about biosecurity is very important points to be able to have change. The four instruments is to include biosecurity in teaching and for preclinical training, and here is related to epidemiology, but it's recommended by the tripartite. And you find that it's a website with presentation of the cursus general biosecurity and biosecurity for all of the different clinics of entity, autopsy, necropsy, anatomy, etc. And you have 2 years of introduction of in animal biosecurity in a 1L perspective, and the presentation of the e-learning platform. And this early e-learning platform, you find the duration itself by student, and the student organize its time in function of this. And after each chapter, you have some formative evaluation by 5 question, randomized question, and the student give response. If the answer is not good, it pass a second fault about this chapter. If it is good, the passage to the second chapter is possible. And in the final phase, we have, of course, certification evaluation by QCM. MCQ, sorry, it's in English. You use also some audit in the field by the student, because it's important for a student that were able to find or to organize an audit of biosecurity in a farm, for example. But it's very broad in terms of different situation. And here we present just, we use an app directly in a tablet, and the student assess the level of the biosecurity by an audit and propose a plan of action. We stimulate also some final project of student for the all of the cursus. For example, how to assess the biosecurity level in stud farms, or determination of hygiene practice and knowledge concerning wildlife health, and more specifically bovine tuberculosis, like this. This is important to involve student in the area of the biosecurity. We communicate also and disseminate about different aspects. Is some example of the production, observation, and the compliance of the biosecurity procedure is very important. Internal audit, and as the tool of compliance with biosecurity in veterinary faculty. And you have, for example, here a serial publication about the integrated management blood feeding arthropod in veterinary teaching facility, like this. Another things, for example, the biosecurity training. Another things about what is a good website. Another things is about what is the economic perspective on farm biosecurity, stakeholder challenge, and livestock species consideration. We organize also some education program at European level of at demand. Here is for the European level cost action. During the cost action, the previous cost action, we organize 5 days of to explain the training for biosecurity SOP, how to develop, how to implement, and how to evaluate directly in the field. Now we pass to the last part of the presentation, is the evaluation, how to evaluate this biosecurity measure of SOAP. We organize this in a progressive pathway to improve biosecurity. It's very important, if you have a progressive pathway, to have a vision for the future. And the vision should be supported by the dean of the VE. Step by step, because the process is long, it's step by step, it's better. Acknowledgement is better than the criticism. If you have a good action, you acknowledge. Good idea from improvement don't not just come from the boss, but several times by the workers. Regular assessment based and on a co-construction grid form, and because it's more interactive and it's more integrative. And we use Biosecurity Day and practical training as a lever for change. And here we find the virtuous cycle, because we assess first, evaluate the respect of the SOP. Second one, we develop a right and biosecurity plan to address properly the identity deficiency. And third, we implement the biosecurity action plan. And after that, we develop and implement surveillance program, because it's a continuous circle. And by the way, we use different tools. You have several audits, but this audit should be diverse. For example, here is a flash audit. It's target 10 critical biosecurity measures by clinic of activity. The second one is a sort of stewardship and compliance of the biosecurity. I explain after, of course. And the third one is the audit of infrastructure, because infrastructure is sometimes new, but sometimes old, but we need to renew this. And also the audit checklist according international standard is more dedicated to hospitals, veterinary hospitals. And by this way, we have two lines. The first line is for each activity and during the activity, and the second line is more dedicated to hospital. For example, pet hospitals is like this one, and also the rest, of course, but it's more specific. And you have internal audit performed by people inside the VE, and you have also external audit that was performed. And by this way, you have VE biosecurity unit that supervise all of the things and integrate all of the information. You have the information shared by the base to the head, and the reverse also, because if you maintain the motivation, it's very important to have a feedback. Here we show, just for your information, a flash audit targeted 10 critical points. You have, for example, a kit, ruminants, and you have just 10 measures. With this measure, you have a scoring of compliance between 0 until 10. If you have about at least 7, you have no additional question. If you have 6 or less, immediately you have 2 additional questions to solve. The first one is dedicated to the acceptability. The acceptability, apart from a practical consideration of possible implementation, is the measure acceptable to you, for example, appropriate, fair, or reasonable. And the feasibility is dedicated to this measure is feasible in new entity, in new clinics, yes or no, by the way of a scale from 0 to 4. 0 is no possible, 4 is the acceptability is elevated, 3 is moderate, for example. And by this way, you aggregate a sort of barometer from a scale from 0 to 100, and you have also a spider by the different, for example, anatomy, companions animal is the different entity, and you find directly what is the level and what is the situation. And after that, we implement a plan of action between the auditor and also the head of the clinics. And if we chose some point to evolve and to improve, you have directly the expected result there, because this one is this one, and here you are the effective improvement. This is stimulate the people to engage to the change. The next one is the audit specific by clinics, and you find here is for ruminants. It's a sort of you have a more long questionnaire, but this questionnaire was performed one by weeks, and you find that you have some implementation, yes, no, needs replacement, for example, of no, etc., etc. And the purpose is to follow the means of the scoring, because here we have the scoring during the different weeks. You have for one semester the different weeks, and you find U level. Here is the means, here is the 95% confidence interval, and here is the outside odd layer. And the odd layer is important because if you have odd layer less of above you acknowledge, of course, but if it is less, for example, here in this part, you need to essay to understand why and to discuss with the staff to how to implement of to improve this problem or to solve this problem. The next is the audit for infrastructure. And for the infrastructure, it's very important to have in your head problems to solve. What is the problem to solve? What is the plan of action to fill the gap? What is the status of the action? Who perform this change? Have you a deadline? And to verify. If you have this, it's a sort of sheet, you have the possibility to verify this quickly, frequently, and to follow the evolution of the process. Here is more complex. It's an audit of hospitals, for example, pets. It's a joint collaboration because it exists in US, but we organize this with US and Canada to use the available information and to improve this information by a novel of an update version. We have this update version. Currently, it's a form quasi to the app, but it's very important to have the same bear view. What is the current situation, the acceptability, the feasibility? And by this way, you have the same. You have here a barometer, you have the spider, and by the spider, because it's only one clinics, you have, for example, hygiene. You find infection control program, isolation area, laundry, pest, etc., etc. Training information, it should be less here. Thus, probably it's a lever to change. And here is novel because we organize the proposal to have some biosecurity measure to change in function of the acceptability and feasibility in decrease order. And by this way, the chief of the clinic and the auditor should be discussed and choice, but the decision should be for the manager, of course. And when it shows one measure, for example, to add, you have directly the effect and to stimulate, and the rest is a plan of action to verify that is implemented or not. And the feedback of an action plan is very important in this area. The next step is the fact that it's not just a question you use of not a biosecurity measure, because it's also the behavior of the people to need to change and to engage the people to change this biosecurity or to use the additional biosecurity measure. And for this one, we use the health belief model that coming from the human area. And you have psychological characteristic, demographical variable, and the purpose is to modelize the intention of action and to pass to the action. And it depends to the susceptibility, the barrier, the clue of action, the health of motivation, the benefit, the severity, etc. And we use this, just an example, for example, cattle during a survey, and you find in green the positive association and in red the negative association. You find that experience here and education level is two very important associated by security knowledge, and by this way also by health responsibility, and finally to the overall biosecurity level that should be increased. This is very important to target this, but by the way of different stream. Gender male are less risk aversion. This is should be some problematic. This is need to be aware about this. And for example, here you have organic farm is less in terms of health responsibility and overall benefits of the biosecurity measure. But you find that risk aversion are an effect also and earth size. This it's a sort of how to understand well the change of the behavior of the people, and what is the possibility to have a lever to change the situation and to improve the situation. Finally, some inspiring perspective, real-time audit tools. I think it's very the current inspiring direction to move. The development of virtual visit and serious game, inclusion of digital tools and artificial intelligence to assess compliance. We prospect also the edition of the book, Community of Practice. You have a good example with the FAO. The cost action should be dedicated to the VE biosecurity. The practical training school in animal biosecurity, the MOOC, but all of these initiatives need to find some money to support and to move from the contemplation until the action. Here we show some example. We develop some app currently. It's very beautiful, very interesting, and inspiring for the student. And the student like very well this. You have, for example, ici ATP metre. With this ATP meter, you have the relation with the contamination and this ATP presence. By bioluminescence, it's fine and it's easy to use. You have also, for example, RFID tag that was, for example, in the boots, and you follow the different movement of people inside clinics, for example, and some interdiction area. And you find also here the recognition by face recognition by artificial intelligence. It recognizes, it pass. It do not recognize the door still is closed. And you have also the possibility to have a virtual fence, here a very virtual fence. When the people, if you adapt this with this, if a people move to other area directly, you have a message. Thus, it should be interesting. Main conclusion is to have a representative of the main actor clinic that you need to integrate in the biosecurity team. Is very important to engage the people in the good direction together. The factors that contribute to the improvement of VE are the use of biosecurity SOP, of course, the number of the visit of the veterinary education establishment, biosecurity website, the number of people trained, and the biosecurity audit. It should be important to have reactivity. And also very important, the participation of students of all of the level, of the degree, of the different year of the student training, and also the mutualization of effort. If you have a good idea, you share this idea to all. Finally, I just remind you some information about some call. We have a call of participation for an audit of animal hospitals for pets. If you have an interest, please contact me directly. We have the questionnaire, but we need to validate this questionnaire. And by the way, of 30 different hospital that should be investigated in Europe and in North America. Is it possible to validate this? And also a survey on training needs and animal biosecurity. Currently, we have around 1,000 response, but we should be to pass this number. This 1 week of 2 weeks more. Is it possible to give a response? We have this one. You have the QR code. If you have an interest, use your phone and capture this, and directly you go to the website. Not forget that you have the possibility to aggregate WABA, the World Animal Biosecurity Association. You have this link. By this link, you have the possibility to become member. If you have not currently, please go to this. And finally, we have a call of volunteer because this webinar series was organized by the WABA by the help of the WABA Scientific and Information Committee that was shared by Mo Salman and myself. And to help to ensure fair representation within this committee, we organize a survey. You have this link, and we suggest to you to visit the questionnaire to give some response if you have an interest. Thank you very much. It's all of the staff that helped me to have this presentation. And now we pass the floor to FAO for the question and the response.
Thank you very much, Claude. Very interesting to learn how the veterinary establishments under the University of Liège are handling the biosecurity. And I have a few questions in my mind, but I will prioritize those questions that we have in our Q&A box. The first one is around the Biosecurity Day. And when do you choose to have this Biosecurity Day? Is there a specific date, or is it just mainly because of the availability of faculty and other people participating?
Yes, depending of the year. This year, we organize this face to face. Some year, for example, during the COVID period, we organize this by website online. This year it should be a little bit complicated. But if some people need to join Liège, is it possible? Is the 27, but I send the information to you if you have an interest.
Okay, we can post that also in the community of practice, Claude, to inform people.
Yes.
Just related to this, is this Biosecurity Day? My understanding is that is mainly targeting faculty members and students and people in the university. Do you open the day also to farmers in the area or to other actors?
Yes, it's open for the private vet. It's recognized by the agency. This is it possible to valorize this in a continued education program. If a specific farmer are interested, it should be moved. But we organize, we give the publicity to all, and all the stakeholder that was interested. It's open for them.
Thank you very much, Claude. The second question is about compliance, and let me read it so you can have a clear idea of what they are asking. And it's basically, how do you translate biosecurity SOPs into consistent day-to-day behavior in a setting with frequent students rotation and heterogeneous staff biosecurity cultures? Which mechanisms have proven most effective in your experience? And some of examples is curriculum embedded repetition, supervision models, peer-to-peer reinforcement, or assessment linked compliance.
Yes, in fact, in Belgium, only two faculty had the possibility to follow the on-tier cursus. It's Ghent and Liège. Before, the three first year should be performed in another university. Just for this reason, for example, in the south part of the Belgium, I give the cursus in the last year of the first part of the training program, preclinical program, the last year, just before to become in the clinics. And we perform the same cursus in the different university. It's myself, in fact, and all of the other university should be integrated the e-campus from UDH. It's not a problem. It's just a question of open to the system. And by this way, we have the same pre-initial cursus. In fact, when the people, the student move to Liège, before the first part of the clinics, it's give a reminder, a small PowerPoint presentation with the key points, and all of the student was we demand to all of the student to move directly to the website, the biosecurity website, because all of the clinic is, for example, I don't know, equine clinics. One, what is my main job before to entry to the clinics. During the clinics, what is the most important biosecurity measure, and after the activity. This is the same reasoning for all of the students. It's more easy. And the third one is also a sort of stewardship. During the week of the clinics, some students are responsible for example, you clean, you wash and clean your hand, for example, of the boots. We need some material, some product, etc. Is the responsibility of the student. And by this way, it's important. I think the stewardship is very important because you need to repeat. Sometimes you forget, okay, we learn, we have students. This is very important to repeat, and the stewardship is very important.
Yeah, thank you very much for putting emphasis on that. Repetition is what create habits, right?
Yeah,
And
yeah.
so we are not very good at creating new habits. So this is something that we need to be refreshed and reminded
Uh,
continuously.
and also the responsibility of the student, because some students are irresponsible, and it's passed very more good by this way. Huh?
So maybe touching on that, Claude, what happens when a student doesn't comply with the SOPs? Because in a farm, in a company, you might lose your job, right? So you have this incentive of following the SOPs. What happened in the case of students?
Yes, but in fact, the student move to the stewardship, but also to evaluate the compliance with the biosecurity inside the weeks of the clinics. And by this way, it's a student that verify the works of the
Other students.
congener. This is
Yeah.
very important. It's pass better than it is the teacher. This, I think it's very good idea because the responsibilization of all of the actor is very important itself.
Thank you very much. The next question is actually linking to this, to the evaluation and monitoring of biosecurity competence among trained students and staff over time, beyond just attendance or knowledge tests. How do you actually evaluate this? And I think you touch on the audits and also this peer pressure. Uh, but they ask which indicators or tools have proven most useful in distinguishing formal compliance from real operational competence.
Yes, it's a very good question. But in fact, it's a continued process. We evolve progressively. Thus, for me, the most important is to follow the proposal. For example, you have a biosecurity day, you propose, the people come back. Okay, it's good, first good points. The second point is the participation. You have the possibility to evaluate, but evaluation is good, but participation, real participation is more good. And by this way we organize all of the day. The morning is more for speaking note like this, etc., and discussion, and the afternoon is dedicated only to the practical aspect. Directly you have in field condition, and you practice yourself, and you have an evaluation by your peer of your colleagues, etc. What is the good idea, what is not the good idea, why, etc., etc. This, I think, the involving in the process by the people is more important than an evaluation. And after that, we have the possibility to evaluate. But currently, first, we check if all of the people are at least, for example, one followed by 5 years or 3 years present and participate, because we have all of the verification, because it's online registration, etc., etc. And also, the fourth step is to have, for example, a QCM of online, and you manage this easily. And by this way, you have the possibility to address, to include this in your continue education program that was verified outside.
Thank you. Thank you for the additional details. And the next question is about, I mean, you already mentioned some details of your auditing in your faculty, but there is a question on certification and training of auditors. You mentioned you sometimes are students themselves who are doing the auditing. So I guess you don't have a certification of auditors, but maybe you can develop on that.
Yes, but in fact, we learn about to educate students to become an auditor. It's just a question of D1 scale. Okay, it's very important for me because after the veterinarians move to the field, and after that, some agency, okay, you need to fill a questionnaire, you need an audit. Okay, but why, etc. This, I think it's very important to be aware for a student very early what is an audit, how to combine this, etc. And we have 1 week to explain this with student, with small group. And the small group, we explain, we have interaction, etc. And after that, we move to the field and we perform this with the student directly in the field. And after that, we have a feedback because, okay, how to feel this, what is the difficulty, etc., etc. This, I think, is good. And it's verified, of course, because it's my assistant that performed this.
And I think something very interesting from your auditing process is that you are not using it just to assess compliance with your SOPs, but also to gather additional information on the feasibility or the barriers for adoption, which might then shape changes in your own SOPs. So it's
Yes.
not just compliance, but also reviewing the recommendations or the measures that you have in place.
Currently, we have in the audit, en fait, what is the true reality, and you cross-check by visit of the clinics, of course, because if you not cross-check, it's not a good way to work. You cross-check. You have a good audit because a lot of audit is in a room, but it's not my philosophy. The audit should be in the farms, really. And by this way, you integrate the acceptability and the feasibility, and we discuss to this. But also we have some other things, but it's more related to the research. But we perform this inside. The health belief model was designed also in the faculty. This is very important to have this because if you have this lever, it's important to discuss in the biosecurity team unit because it's a proposal of plan of action to increase this with students because students are there. This,
Yeah.
I think it's a good way to work. It's a multiplication of the different windows to show the same things, but we aggregation, synergy, etc. And the final purpose is to increase the biosecurity and to maintain the good level of biosecurity.
Yeah, of course. There is one question about applying these in low resource settings, Claude. Many of the members in our community of
Yeah.
practice are coming from low and middle income countries. So
Yeah.
how best can biosecurity measures be implemented in these settings, or how this model that you presented can be
Mhm.
replicated in these
Yeah.
low resource settings?
Yeah, yes, this is an excellent question. But first, we have a model and we share because if people are interested, we share. We have also some dedicated activity in other university to have a pre-audit of like this to help. It's the societal aspect of my activity, of course. But for low-level country of a developing country, we have some novel project. We start a novel project, for example, in Latin America for 5 years, and it's one of the purpose is to translate this in a specific condition of middle of or small country with in developing to be able what is the main important for me the behavior should be translated easily, but we need to adapt in the context of local context because sometimes you have no fence. If you have in Africa, you have no fence except um, the etatic farms, but for the rest, you have no fence. Thus, we need to adapt. For example, the farms is not perhaps not the good unit, perhaps it's the village, the unit, the good unit, and like this. And we have also some activity, but not me myself directly, but some past assistant was also moved to Laos for several months, and we organize also some novel things about biosecurity for this. Thus, we are aware about this. It's very important, and we need to have sort of SOP for developing country after, and perhaps to engage some discussion with the FAO and the World Organization for Animal Health to have some SOP that was of minimal SOP should be shared by all of the people. I am available for this, of course.
Yeah, thank you very much, Claude. I think that will be a very useful material. We are running out of time, but there is one additional question that I would like to pose to you, and is based on your experience, which measures or in which areas do newly graduated veterinarians most frequently deviate from the SOPs in practice?
Yes. Um, well, we have some. I present in my presentation some things, but we have but a few. It's first one because I think the education is the first step, and to be verified that all of the people have this first information education. Um, Sometimes it's some deviance about we forget some things like we forget the habits, etc. But by the way of this evaluation process, stewardship is less because you are not alone. You are also you congener right there, and you have some motivation to be good. This I think it's good for this. Um, the cleaning and cleaning and disinfection of, for example, the boots is very important. Sometimes some people forget, but not necessarily in all place, because, for example, not forget in class 4, because class 4 it's specifically designed to not forget because it's mandatory if not pass, etc. For example, for necropsy room you have food bath, but the food bath is too long, it's not possible to pass. It's very important, you need to pass because it's impossible to jump 4 meters like this. Thus we need to adapt.
Yeah, definitely. Changing the architecture to facilitate
Yeah,
compliance, I
yeah,
think.
yeah, yeah.
Thank you very much, Professor Claude. We are running out of time. There are still a couple of questions or requests in the chat that we will continue discussing offline through the community of practice. We will create a post and you can see the answers there. But I want to use this last minute to thank you and to thank everybody who connected to this webinar. Remember, this is a new series that is done in close collaboration with the World Animal Biosecurity Association, and we are delighted to start this initiative. Any last word, Professor Sagerman?
Thank you very much to all of you, and also specifically aussi for FAO. That was a very good platform to share information. And I think just one word, sharing of information is the best way it works. Thank you.
Thank you very much for those last words of wisdom. And see you next time.
Thank you. Bye-bye. See you later. Thank you.